Gentlemen, I want to talk with you today about something that is completely normal, deeply human, and yet rarely discussed honestly, especially as we get older. As men move into their 60s and beyond, many aspects of life change. Our routines change, our priorities shift. Our bodies evolve in ways that are sometimes subtle and sometimes very noticeable. Sexual health is one of those areas that often gets pushed aside, not because it stops mattering, but because men are taught not to talk about it. One topic in particular tends to carry unnecessary embarrassment, even though it has been part of human life for as long as men have existed. That topic is masturbation. Let me say this clearly and without hesitation. Masturbation does not suddenly become unhealthy or inappropriate because of age. It does not mean something is wrong with you. It does not replace intimacy, nor does it diminish masculinity. In fact, for many men over 60, it continues to be an important part of physical comfort, emotional regulation, and sexual self-awareness. What does change with age is not whether masturbation is acceptable, but how the body responds to it and how it should be approached. Over the years, working with men in later decades of life, I have noticed a pattern. The act itself is not the problem. The problem is that many men continue using the same habits and techniques they developed decades earlier without realizing that aging tissues require a different kind of care. When the body changes and behavior does not, discomfort, irritation, and even injury can follow. The good news is that these issues are almost always preventable with a few thoughtful adjustments. As men age, skin becomes thinner and less elastic. Blood flow may not be as robust as it once was. Nerve sensitivity can shift. Hormonal changes can affect moisture, arousal patterns, and recovery time. None of this means pleasure is gone. It simply means the body now speaks a slightly different language. Learning to listen to that language is one of the most important forms of self-care a man can practice after 60. One of the most common problems I see comes from friction. Natural moisture often decreases with age, and when dry skin is repeatedly exposed to rubbing, the tissue becomes vulnerable. Small tears that cannot be seen with the naked eye can occur. These micro-injuries may not cause immediate pain, but over time they can lead to inflammation, tenderness, and sensitivity changes. Some men even develop anxiety around sexual activity because of discomfort they do not fully understand. Using an appropriate lubricant is not a sign of weakness. It is a sign of wisdom. A quality lubricant reduces friction, protects delicate skin, and allows sensation to feel smooth rather than abrasive. Many men tell me they wish they had started using lubrication years earlier because of how much more comfortable and enjoyable their experience becomes. Generosity matters here. A small amount is rarely enough. Reapply as needed and choose products designed for sensitive skin. Another issue I frequently encounter is excessive force. Many men learned early in life that stronger grip and faster motion created more sensation. While that may have been true in youth, aging tissue responds differently. Aggressive techniques place stress on blood vessels and nerves that are no longer as resilient. This can lead to bruising, lingering numbness, or reduced sensitivity over time. Paradoxically, trying to force sensation often results in less sensation. Slowing down changes everything. Gentle, rhythmic movement allows blood flow to build naturally. It gives the nervous system time to register pleasure rather than shock. Many men are surprised to discover that less pressure actually increases sensation when the body is allowed to respond at its own pace. Masturbation after 60 should feel comfortable, controlled, and intentional. Pain is never a requirement for pleasure, and it is never something that should be ignored. Listening to the body becomes more important with age. Discomfort is information. It is the body's way of saying that something needs adjustment. Ignoring that message does not build toughness, it creates problems. If something feels wrong, stopping is not failure, it is self-respect. Hygiene is another factor that is often overlooked. After ejaculation, residual fluids can remain on the skin. Warm, moist environments encourage bacterial growth, especially in men who may already be managing conditions like diabetes or urinary changes related to prostate enlargement. What seems like a small issue can become irritation or infection if cleanliness is neglected. A simple routine makes a significant difference. Gently washing the genital area with warm water after ejaculation helps maintain healthy skin. If a cleanser is used, it should be mild and fragrance-free. Harsh soaps strip protective oils and can worsen dryness. Thorough drying afterward is just as important. This small act of care supports comfort and reduces unnecessary risk. Beyond physical considerations, there is also an emotional and psychological component to masturbation later in life. Sexual expression remains a valid part of identity at every age. Pleasure is not reserved for youth. It is not something that expires. For many men, masturbation helps relieve stress, improve sleep, and maintain a sense of connection with their own bodies. It can even reduce anxiety by releasing tension accumulated throughout the day. Frequency varies from person to person. There is no universal standard that defines what is normal. Some men engage more often, others less. The body will usually signal what feels right. As long as the experience is comfortable and not interfering with daily life, there is no reason for concern. Comparisons are unnecessary and often misleading. One important point cannot be emphasized enough. Any persistent pain, bleeding, noticeable changes in shape, ongoing numbness, or difficulty achieving or maintaining erections should never be ignored. These symptoms are not something to feel embarrassed about. They are medical signals that deserve professional evaluation. Early attention leads to better outcomes. Masturbation is not a substitute for medical care, nor is it a diagnostic tool. It is simply one aspect of sexual health. When practiced thoughtfully, it supports awareness and comfort. When practiced carelessly, it can contribute to avoidable problems. The difference lies in mindfulness. Aging does not mean giving up pleasure. It means refining it. It means choosing comfort over force, patience over urgency, and awareness over habit. Men who adapt their approach often report greater satisfaction, fewer issues, and more confidence in their bodies than they had years earlier. Taking care of sexual health after 60 is not about trying to reclaim youth. It is about respecting the body as it is now. When men treat themselves with kindness and attention, the body responds in ways that support long-term well-being. If this conversation resonated with you, take it as encouragement to continue learning about your health. Ask questions. Stay curious. Pay attention to what your body is telling you. Sexual health is part of overall health, and it deserves the same care and respect. In future discussions, we will continue addressing topics that many men quietly wonder about but rarely hear explained clearly. Understanding changes in desire, energy, and intimacy later in life is empowering. Knowledge reduces fear and awareness leads to better choices. Until then, take care of yourself, stay informed, and remember that prioritizing your well-being is not selfish, it is essential.